Kia ora, nau mai ki te whare. Welcome to the House, ko Louis Collins ahu. When a new government is formed, it's not uncommon to see the establishment of new ministerial portfolios. One of those, established by this government, is the Minister of Mental Health. This role is currently held by National's Matt Ducey. He is in charge of the Mental Health Bill, which repeals and replaces the Mental Health Compulsory Assessment and Treatment Act of 1992. The bill's purpose is to modernise and make clear the rules for when the state may get involved to provide mental health treatment to someone without requiring their consent. This morning, the Health Committee heard from members of the public who had made a submission, many of them with first-hand experience of compulsory mental health treatment. Prior to that, though, the committee had the opportunity to hear from and question New Zealand's very first Minister of Mental Health and Minister in charge of the bill, Matt Ducey.
An absolute privilege to be New Zealand's first mental health minister. And in my view, mental health is about lived experience. It's our shared stories and experiences that bind us together. I know you're hearing submissions on the 12th and 19th of February. And I want to encourage you to take time to hear those stories, because this is a once-in-a-generation opportunity.
Following the committee's time with the Minister, members got the chance to hear some of those lived experiences that Ducey talked about as being at the centre of mental health. One submitter, Louise Allen, lost her daughter last year to alcohol harm-related mental health. She shared her experience and suggested that the bill should include clauses for alcohol-related harm, as well as the inclusion of families in the treatment process.
One of the greatest injustices is how our system locks families out, even when they're the only ones fighting for their loved one's survival. My family fought relentlessly for Rose. We begged for help, but time and again we were told we can't share that information. She has to make that choice herself. But alcohol had already taken that choice from her. When Rose needed us most, we were locked out, and then we lost her, not just to alcohol, but to a system that refused to let us fight for her.
Also sharing his insight was Barry Welsh, who had personally gone through the experience of compulsory care.
I had my first psychotic episode at 21 years old, just after finishing the BXI degree at Lincoln. This led me into Lake Alice. Over the years, I've had quite a number of serious episodes that required admission under the Mental Health Act, the most recent in 2017. Before my 2017 admission, my two-page crisis plan completed by my GP and I had been lodged with the service. But as it turned out, the service had, without my knowledge or consent, cut the plan down to 3 lines and excluded my wife, whom I wanted involved in my care as primary contact. My wife was also my power of attorney that I had set up in 2015 in case I became unwell. Without the valuable information that was in the 2-page crisis plan, the crisis team did not respond appropriately to requests for help from my wife and my sister when I was very unwell. After police intervention, I was finally admitted into the acute unit under the Mental Health Act. The service went on and consulted with family members who I had had very little to do with and did not want involved in my care. Because the service lacked valuable information on my 2-page crisis plan, including my wife as primary contact, my wife was excluded, even though they knew about the power of attorney, thus losing valuable information about what I was like at equilibrium. This significantly contributed to me having a nearly 6-month inpatient stay, putting incredible strain on my wife, and also almost costing me my job and my life.
Personal stories from the public regarding any bill can be invaluable to committee members. They help bring the policy intentions to life, turning them from written concepts in the bill into real human experiences. Here's Ingrid Leary.
Just around compulsory care treatment, where New Zealand has the highest incidence of that in the world, and you would have presumably been under that on your exit from the acute mental health ward. Do you see a positive possibility in using something more like assertive outreach, where you would be able to access, you would be entitled to access mental health care, but it wouldn't be a compulsory thing where they could just lock you up if you hadn't taken your meds? Could you comment on that element?
ideally, the person should be followed up as a matter of course. But if there is difficulty for whatever reason that they can't take their medication or for whatever reason, then I think there needs to be something a bit more support around that. If it's for a short term and the plan's clear that if we can get you to this space, then, you can come off the compulsory care order. Ideally, we wouldn't need them. Ideally, we wouldn't need seclusion. Ideally, we wouldn't need a mental health act. It's not an ideal world, and ideally, we wouldn't have serious mental illness.
Yeah.
The Mental Health Bill will continue to hear submissions on Friday and will report back to the House by the 23rd of April this year. I te whakarongo koe ki te whare. You've been listening to The House, a program made with funding from Parliament's Office of the Clerk. Mā te wā.